What is MRCPCH exam, and how to prepare? What is MRCPCH exam? The MRCPCH examination is a UK membership examination provided by the Royal College of Physicians. Parts of MRCPCH exam. The MRCPCH examinations consist of 3 theory exams and 1 clinical exam. Part 1, FOP and TAS, theory exam. Part 2, AKP, Applied Knowledge and Practice, theory exam. Part 3, clinical examination multi-stations. MRCPCH exam, Part 1, FOP and TAS. Subdivided into Part A, Foundations of Practice, and Part B, Theory and Science. Foundation of Practice is also called Part 1A. Exam duration, 2 hours 30 minutes. Questions in FOP exam includes a computer-based multiple-choice question style exam, 79 single best answer types, 6 extended matching questions. You are given a list of 10 possible answers and you select what best matches the scenario. FOP assess the candidate's knowledge, understanding, and clinical decision-making ability. You can appear in the theory exam after MBBS without any clinical experience. Candidate can appear in FOP and TAS on the same day. Both exams are taking place 3 times in a year. Part 1A FOP exam material. Guidelines books for pediatric and neonatal. FOP case book by RCPCH. Illustrated textbooks of pediatrics. Ethics, palliative, recall questions, sample papers. Part 1B TAS. Theory and Science theory exam. Theory and Science. Exam duration, 2 hours 30 minutes. Questions in TAS exam includes a computer-based multiple-choice question style exam, 70 single best answer types, 10 extended matching questions. You are given a list of 10 possible answers and you select what best matches the scenario. Part 1B TAS exam prep material. Guidelines books for pediatric and neonatal. TAS case book by RCPCH. Science of pediatrics. Ethics, palliative, pharmacology, recall questions, sample questions. Part 2 AKP. AKP is more clinical-based compared to FOP and TAS, so you might find it more fun to revise for. Assesses candidates' knowledge, understanding, and clinical decision-making abilities based on the standard of those entering their core specialist training, which is outlined in the RCPCH website. AKP 2 separate exams, taken on the same day, each 2 HRS 30 minutes long. A computer-based multiple-choice question. Each exam contains 60 MCQ questions made of a selection of single best answers where you choose single best answer out of 5 options. Extended matching questions where you are given a list of 10 possible answers and you select what best matches the scenario given. Note that compared to Part 1 exams, in Part 2 there is additional use of photographs and data interpretation. Part 2 AKP exam prep material. Guidelines books for pediatric and neonatal. AKP case book by RCPCH. Survival guide. New format. Recall questions. Sample questions. MRCPCH exam Part 3 clinical. MRCPCH clinical examination. Multi-station. During the MRCPCH clinical exam, candidates are tested following the objective structured clinical examination style format. Stations 1 to 4 clinical examination. Station 5 development. Station 6 history taking and management planning. Stations 7 and 8 communication. Stations 9 and 10 video. MRCPCH exam Part 1 syllabus. 1. Social pediatrics. 2. Accidents and poisonings. 3. Genetics and congenital defects. 4. Growth. 5. Development. 6. Adolescent health. 7. Neurological and muscular disorders. 8. Learning difficulties. 9. Behavioral and psych prob. 10. Nutrition. 11. Fetal and neonatal medicine. 12. Cardiovascular system. 13. Endocrinology. 14. Gastroenterology. 15. Genitourinary system. 16. Hematology. 17. Metabolism. 18. Musculoskeletal disorder. 19. Ophthalmology. 20. Respiratory. 21. Skin and related tissues. 22. Infectious diseases. 23. Immunology. 24. Clinical pharmacology. Eligibility criteria for the MRCPCH exam. The theory examinations can be taken in the candidate's order of preference. On successful completion of the 3 theory examinations, candidates are eligible for entry to the MRCPCH clinical examination. Candidates will not be permitted to sit an examination unless they hold a recognized medical qualification. Time required to study for the MRCPCH exam. For middle grade PG students, minimum 3 months are required. Beginners should prepare at least for 6 months before they would attempt an exam. 7 to 8 hours a day. Make a plan before you begin your exam preparation. Follow the MCQ and related chapters. Part 1 can be given before AKP, and vice versa. There is no need to wait for any part of the theory, you can give it in the next diet. Thank you for watching this video. Please like and subscribe our videos to stay updated about MRCPCH exam. Visit our website to register for MRCPCH exam courses, www.mrcpch.uk.